Michael, doctors, come on down.
I was waiting for it. Actually, I went for my first visit to a GP yesterday, and I had no trouble getting in. But I do notice that if you want...
Here's my card.
But if you look at other regional cities like Bendigo, you cannot get in. You literally cannot get in. But I think there's some problems with the education sector that link to health, which is there was something like 90 nursing graduates, or there will be 90 nursing graduates this year in Ballarat, or that sort of number. We're taking about 19 or 20 of those. We haven't exactly worked out. If you think BHS will probably take 40, 50, there's actually some that won't get a job in Ballarat. But yet we know that in 2015 we're going to have a shortage of nurses in Australia of around 15,000. That's in 2015. In 2025 we'll be 147,000 nurses short. And I know some of my doctors are here, but that is more scary than a doctor's shortage of 3,000, because literally you go to a hospital and we won't have enough nurses to look after patients. It's that simple. So we have a real skills mismatch in how many people we're putting through and then how many of them can get a job.
So how do you think you can address that?
There's lots of different ways we need to address it. Firstly, there are issues around the training and how job ready the people are. Even in a nursing degree, we spend the next 12 months getting them to a point where they understand the context of being in a hospital. And it's a very challenging thing for a university as well, because how do you get the right level of education into those people before they get into a hospital? We have what I'd consider a crossover. We have the baby boomers who are all hanging on because the economy is not going so well and their super's not real flash. And they're all telling me that the second the economy picks up and their super level goes up, they're out of there. They're retiring, and yet we've got no skills to replace them in a hospital. So there are major problems with how we address that. And adding to that, the ageing population means that we have higher demand for healthcare services. And in fact, both of our hospitals in town, who do a remarkable job, I think, both public and private, are actually close to full at the moment. So both are building flat out, but we can't keep up with demand at the moment. And I believe the public waiting list just for an outpatient appointment is about 8,000 people right now. So that's not even the defined waiting list, that's just the people waiting to see a specialist of some sort. So the problems that are caused by having more people in town really reflect on the healthcare system.
But there are opportunities there too.
Absolutely.
Yeah.
There are huge opportunities in where I sit, being in a private hospital. There's huge opportunities to grow. But we also need government policy to reflect some of that too, because current government policy is fund public hospitals. And most recently has been, oops, we can't do all that elective surgery, so let's get the privates to do it and have tenders, without considering at all that we're full. And most private hospital operators you'll talk to in Australia are close to capacity. So there's a lot of work to be done at a government level, saying, well, how are we going to service this community? Ballarat does better than most because we're actually linked and we actually talk regularly, but in most towns that doesn't happen. So we've still got a lot of work to do about connectivity and how we transfer information between the two hospitals, but also how we transfer those skills, because there's a big issue with clinical dilution of services and not having appropriately skilled people in the right places. So we've got a lot of work to do in the next few years.